Assalamu alaikum. The clinical day. The scenario, Mrs. Lisa Andrew. She is 27 years old, came with a complaint of hand pain. Please sit with her, take history, and address her concern after examination. So we can start now. Timer is
Hello.
ready. Yeah, here you go.
Hello, my name is Dr. Ahmed. I'm one of the doctors in the clinic today. May I confirm that you are Mrs. Lisa Andro, 27 years old?
Yes, I am.
Nice to meet you, Miss Lisa. Today I'm here to ask you some questions about your health condition, and I will need to examine you and answer all your concerns. Is that okay with you?
Okay.
So can you please tell me how can I help you today?
Actually, doctor, along 2 months now, I have hand pain. I come to see what is going on.
I'm sorry for your suffering, Miss Lisa. Do you need any painkiller at the moment?
No, thank you.
Okay, Miss Lisa, can you please tell me more about this hand pain? Where is it exactly?
It is in my fingers,
Is it in
joints
both
of my hand, joints of my hand.
joints in your hand?
Mm.
Okay, is it in both hands?
Mainly in the right hand.
In the right hand. Okay, since starting 2 months back, was it sudden or gradual in onset?
Gradual.
And since starting, is it improving, worsening, or the same?
Worsening.
I'm sorry for that. And can you please tell me what's the nature of this pain exactly? Is it like a dull aching pain, sharp pain, anything else?
Yes, it is dull aching.
Mhm. On a scale from 1 to 10, how would you rank it?
3 to 4 like this.
Have you noticed anything makes it better, like taking any painkiller, any rest?
Sometimes, yes, I tried painkiller, but little improve.
And anything makes it worse? For example, when doing any activities?
Yes, I cannot do any activities by this hand, really.
I'm sorry for that. And have you had any hand trauma or injury?
No,
Okay. Any other joints involved, your wrist joint, for example, or any other joints at all in the body?
yes, my wrist also is involved in this pain.
I'm sorry for that. And apart from that, do you have any other pain anywhere else, like neck pain, back pain?
No, I have left knee pain.
Left knee pain.
Mm.
Since when? Hello?
4 weeks now.
2 weeks. Okay.
Mm.
And can you describe this pain for me? Is it like the
Can
same?
you what?
Can you describe it for me? Is it like the same dull aching pain?
Yes,
Hello?
but I no problem. This only pain.
Hello?
Yes, doctor, I hear you.
Okay. Does this pain worse with movement or with at rest?
When there is no pain in the left knee.
I cannot hear you.
Yeah, Dr. Mohi, please, can you check your connection, internet connection?
I hear all of you properly.
Okay. Continue, Dr. Ryan, please.
I didn't hear what was the answer. Is the pain worse with movement or at rest? Is there any specific? Dr. Mohi?
Okay, wait, Dr. Ryan. I already paused the timer, waiting for his reply. I think he's checking his connection. Wait.
Okay.
Dr. Muhi, when you are back, tell us.
أنا متأسف يا دكتورة والله، اتفضلي معلش، متأسف
It's
والله
okay,
ما
Dr.
أعرفش
Muhi. No worry, no worry.
لا ما مشكلة.
You're okay
No
now?
worries.
Good. Yes.
اتفضلي continue.
Okay, go ahead. Continue, Dr. Ryan, please.
Okay. So regarding the left knee pain, is it worse at rest or with the movement?
Yes دكتورة yes.
With rest?
With rest yes.
Worse with rest, yes? Isn't it?
Yes.
Okay. And what about the hand pain? What about the hand pain? Is it
what
also
about-
worse? Is it also worse at rest?
Yes, worse at rest.
Okay. Any associated morning stiffness?
Yes, doctor, yes, you are right.
For how long do you have the stiffness?
I think it is about 4 hours. I cannot cope and daily activity by this stiffness.
I'm sorry for your suffering. And any joint swelling in your hands or your knee?
Yes, in the small joints of the hand there is a swelling. Yes.
Okay. And
Any what?
skin rash?
No skin rash. No skin rash.
Okay. Now regarding the knee, have you had any knee trauma?
No.
Okay. Any swelling behind your knee?
No.
Okay. Any eye pain or eye grittiness or eye redness?
No.
Okay.
No.
Any skin rash on sun exposure?
No.
Any soreness in your mouth, or sorry to ask you, soreness in your
No.
private area?
No.
Okay. Any tight, shiny skin?
No.
Okay. Any muscle pain or muscle weakness?
Yes, sometimes I cannot cope for combing my hair and also brushing my teeth. No, I cannot do this.
I'm sorry for that. Okay. Any change in the color of your hands on exposure to cold or during stress?
Yes, doctor. When it become cold, I feel some pain and the color change. It become very pale, mainly in the index finger and the middle finger also.
Index and middle finger. And what's the color exactly? Does it change to white color?
It become pale. Yes.
Pale.
Yes.
Pale. Okay. Okay. Apart from that, do you have any raised body temperature?
No.
Hello?
No, doctor.
Okay. Any past medical history I should be aware of?
No, I don't have any past medical history.
Can you show me your medication list?
I don't have any medication list.
Any surgeries or procedures?
No.
Okay. And any lumps or bumps in any part of the body?
I'm not sure for that.
Any weight changes?
No, my weight is stable.
Any change in appetite?
No.
Any weather preferences?
No.
Anyone told you that you became paler than before?
No.
Any yellowish discoloration of your eyeballs?
No.
Okay. Any headache?
No.
Any dizziness on standing from a sitting position?
No.
Any mood changes?
My mood is okay, but I am worried. What is going on with my hand?
I'll try my best to help you, Miss Lisa. And any sleep issues?
No, I sleep good.
Okay. Any difficulty swallowing?
No.
Any breathing issues, breathing difficulty?
Actually, Doctor, yeah, with effort, I feel that I become difficult to breathe. Yes, you are right. This when under daily activities, I can breathe properly. But when I do extra effort, I feel some shortness of breathing.
Okay. And for how long do you walk before you feel short of breath?
My daily activity has no problem, but when I do extra work like climbing stairs or running with my dog, I feel some shortness of breathing. I don't know if this is related or no.
Okay. And do you have any cough or coughing of blood?
No, no, no,
Okay. Do you have any chest pain?
no,
Any awareness of heartbeat?
no, no, no,
Any change in your bowel habit?
no,
Any change in your water work or frothiness of your water work?
no, no, no,
Any tummy pain or tummy bloating?
no,
Any feeling sick or throwing up?
no,
Any leg swelling or swelling in any part of the body?
no.
Any problem with your sensation at all, like your feeling or loss of feeling?
Again, Doctor, what?
Loss of problem with sensation, change in sensation, loss of sensation.
Yes, you are right, Doctor. Sometimes at night I feel some pins and needles in my right hand, in the fingers, like this. I don't know what's this.
Okay, since when are you having this problem?
This is about 10 days now.
I see. Okay. And exactly
What?
which hand
Hello?
you feeling pins and needles?
Right hand, right hand, right hand.
Right. Okay. Any snoring at night?
No, no.
Okay. Can I ask you some personal questions, please?
Okay.
Can you please tell me about your periods? How are they? Are they regular?
Yes. I actually, Doctor, 1 month, this last month, no cycle came. I don't know why. My,
1 month.
I'm not sure. Yes, maybe pregnancy. I'm not sure.
Okay. And are you in any unprotected sexual relationships?
And what?
Unprotected intimate relationship.
I am married, Doctor. I am married.
Do you have any kids before?
What?
Do you have kids?
No, no,
Have you had any pregnancy loss?
no, no, no.
Okay. And are you taking any birth control pills or any uh,
No.
pills for?
I,
Sorry?
no, no, no. I did not use any of this.
Okay.
I
And
was
have you
planning for. Hmm?
okay? And have you checked your pregnancy test or no?
No, because only 1 month. I'm not sure. I will check later. This is
Okay.
not issue now. Now I'm concerning with hand pain.
Sure, no worries. And any change in your diet at all?
No.
Okay. Can I ask you some personal questions?
Yes.
Family, any smoking? Do you smoke?
No, no, I'm not smoking.
Do you take?
No, I'm not taking alcohol.
Okay. And what about your family? Any disease runs in family or
What
any
about what?
your family? Any
What
family
about what?
history? Any family history of note or family history of a
History?
joint problem?
No, no, no,
Okay. And I'm sorry to ask you, any sharing needles or party drugs?
No.
Any recent travel?
No.
Okay, can I examine you, Miss Lisa?
Okay. Then
I would like to check the vital signs of the patient.
it is like outside. It is all are normal.
Okay, I want to check the hands for any joint
Yes.
swelling. I will offer the pillow for the patient, and then I'll check the nails, any nail pitting, nail changes, leukonychia, koilonychia, swelling
Nail are
in,
normal.
okay, joint swelling
Swelling where?
in the joints,
Which joint you wanted
DIP,
to look for? Which joint?
uh,
Huh? Yes.
DIP, BIP
This
joints.
the first. Yes, there is in the middle finger and the index finger, the proximal and the middle interphalangeal joint are swollen.
Proximal and what? Sorry? Can you repeat? I cannot hear you.
Proximal interphalangeal joints and metacarpophalangeal also. There is
Proximal
swelling.
interphalangeal joint and metacarpophalangeal.
Yes, yes, yes.
Yes, so
What?
which fingers involved? All?
Middle and index.
Middle and index, okay. And any redness, any deformity?
No deformities, but there is only swollen, and this by inspection, yes, yeah, only by looking you will look this there is
Okay.
swollen.
Okay, what about the turning the hand on the other side
Which side?
to the elbows? Any in the elbows? Anything? Rheumatoid nodules?
Yes, how you will check this? By what? Yeah, by what? By your back of the hand or by the palm? There is
By the palm.
yes, there is nodule, yes. Near to the elbow, the external surface of the elbow. Yes.
Okay, time is up, but I will add 2 minutes for the internet connection. You can ask the concern after finishing examination, Dr. Ryan, please.
Okay, so I'll say the examination. If you can give me the findings, Dr. Mahi, is it fine? Because I think the connection is an issue to get the answer. Is it fine with you?
What?
So I will fill in.
What?
So in the hand,
You
I will.
only do in the hand what? Till
Yeah, I
you
want to
ask
check.
me and I will.
Okay, I want to check the pulse and the sensation in the hand.
Pulse is
And
normal. How you will check sensation in the hand?
by any method, like cotton, and then I will check for carpal tunnel.
Yes, by sensation it is intact. Yes, sensation by cotton it is intact.
Okay,
There
carpal tunnel
sensation
syndrome.
by
I will. Okay, for carpal tunnel, I will warn the patient about. I'll tap at the wrist joint. If they have any pain or electrical sensation or any abnormal sensation, to let me know. If they allow to tap, then I will tap at the wrist joint.
Examiner told you no need for this tapping on the.
Oh, okay. I would like to check the movement of the joint of the hand muscle. I'll ask the patient to do a fist and open the fist, and then assess the hand function.
With difficulty, yes, with difficulty. You wanted to check the function of the hand. There is
Yes.
some difficulty, yes. It do, but with pain.
Okay.
The prayer sign and the reversed prayer sign, difficulty to do. What else want you to do?
Any deformities in the hands, or no obvious deformities?
No deformity.
No deformity. Okay. Okay. Then I want to check for proximal myopathy.
Yes, there is proximal myopathy in the arms, both arms. Yes.
Okay. I want to check the eyes for any conjunctival pallor, scleral icterus. Nothing. Oral ulcers.
Nothing. No.
Oral ulcer. Okay. Lymph nodes in the neck.
No.
Okay. Heart murmurs.
No, ma'am.
Palpable P2, loud P2.
No.
Okay. Auscultation of the lung, any crepitations?
Yes, there is some crackles, yes, in the right basal zone of the lung.
In the right base. Okay.
Yes.
And abdomen, any tenderness, organomegaly?
No organomegaly.
Legs, any swelling?
Legs?
Yes, in the legs,
No
any
swelling.
swelling?
No swelling. No swelling.
Okay. Miss Lisa, what are your concerns?
بس احنا دخلنا على
ها. ها؟
No worries.
يعني
Go ahead for the concern now. Yes, because of the connection.
الاكزامينر كريمة قوي معاكي اعطاكي وقت طويل. Yes.
Okay,
Continue.
Miss Lisa, what are your concerns?
Sorry, I wanted to ask you what is going on with me.
I highly Mhm.
Yes.
I highly appreciate your concerns, Miss Lisa. I think you have a condition called mixed connective tissue disease. Don't bother by the name. This is a problem in which your defense system attacks multiple parts of the body, leading to the symptoms that you have. We need to run some blood tests and we need to do some scans. And we are going to involve a group of doctors, including the joint doctor and the physiotherapist, and we will manage you accordingly. Is it okay with you?
So it is curable, doctor? I will be normal like all individuals?
It can be managed with medications, Miss Lisa, but not necessarily completely curable.
Okay. You will admit me, doctor? The hospital?
Now, because of your breathing issue, if we found your saturation to be like your oxygen to be on the lower side after the initial investigations, we might need to admit you. Otherwise, if you are stable, we can run the investigations as outpatient.
Okay, time is up.
Nurse, check my... Okay.
Okay, the last concern, Dr. Mahia. Say it, then we can start to examine the questions, please.
The nurse checked my vital signs and they found oxygen is 99% on room air.
Then we can manage you in the outpatient clinic, Miss
Okay.
Lisa.
Okay. Okay.
Okay.
Okay, examine our questions now.
مين الإكزامينر؟ حضرتك بقى.
No. Ask her as you are the one examiner.
Okay, Doctora, can you summarize to me the positive findings this patient?
Yes, I examined Miss Lisa, 27 years old female, is presenting with hand pain for the past 2 months, and it's mainly in the joints of the hands of gradual onset, dull aching pain, and associated with the Raynaud's phenomena, and also she has left knee pain for 2 weeks, mainly going with inflammatory type of pain. She also has proximal area for around 1 month. Also, she has pins and needle sensation going with carpal tunnel syndrome. And on examination, she has joint swelling and tenderness at the BIP joint and the MCP joints. And she has proximal myopathy. Apart from that, she has no other anything in the examination, positive findings. I forgot to examine the knee, by the way.
So the diagnosis is what now? What's your diagnosis?
My top diagnosis is mixed connective tissue disease. Could be rheumatoid arthritis.
Why? Based on what?
Based on the...
Why you...
based on the joint pain and stiffness going with rheumatoid arthritis along with the proximal myopathy. Could be due to polymyositis and...
But
I
there
think
is
that
no rash.
polymyositis,
no
no
rash
rash. Not necessarily there is rash in polymyositis. Dermatomyositis. Sorry, dermatomyositis will have rash.
Can be associated. This can be associated only. Proximal myopathy can be with rheumatoid alone. Mixed connective tissue means systemic lupus or systemic sclerosis or polymyositis.
Yes, you are right. Could be.
But this is only rheumatoid. Okay.
Only rheumatoid? This one?
Yes, this case is only rheumatoid. There is no mixed connective tissue.
Okay, okay.
If you say mixed connective tissue and I say rheumatoid, how we can confirm by laboratory if it is mixed or it is only
If
rheumatoid?
if
How?
mixed, we will run the anti-RMB antibodies. It will be positive in mixed connective tissue.
Yes, yes, RNA. Yes, okay. So what is differential diagnosis other than rheumatoid?
So actually, I wrote for the hand pain, Raynaud's phenomena, rheumatoid arthropathy. Now for this collection could be SLE, but against that there was no any history of rash or photosensitivity. I think that's it.
Okay, okay. So how you will manage this case?
Investigations?
The investigation you will do? A
Yeah,
specific
investigations.
investigation, what you will do?
Okay, investigations, basic investigations in the form of full blood count with differential and ESR, CR. Sorry?
Specific investigation for this case?
Specific investigation, rheumatoid factor, anti-CCP antibodies, double-stranded DNA antibodies, CRP, ESR, hand X-ray,
So, yeah,
ENA.
hand X-ray, yes. What you will see in the hand X-ray, what you will see, what you will look for.
And the hand X-ray, they can have periosteal osteopenia, I think, and they can have joint
Yes.
narrowing of the joint space, and they can have effusion.
Yes. What else?
I forgot what else.
Okay, okay. So what is the treatment? What you will start is for this woman?
So non-pharmacological disease education and counseling and avoidance of the triggers, especially for Raynaud's phenomena, avoidance of the cold exposure. And she can use also mittens and involvement of multidisciplinary team approach, including rheumatologist, physiotherapist, specialized staff nurse, and controlling the comorbidities and the treatment, the pharmacological treatment of the disease.
Treatment? What is the pharmacological treatment?
Yes, painkillers, and then DMARDs like methotrexate, hydroxychloroquine,
yes, she told you
anti-TNF.
that she no cycle for 1 month, possibly pregnancy. So how you will proceed in
So
the
we can go for
pharmacological treatment?
yeah, we can go for the options that are safe for pregnancy, like sulfasalazine.
Yes, sulfasalazine. Yes, it is the safest one. Okay.
Yeah.
What is the medications contraindicated here as anti-rheumatoid in pregnancy?
Methotrexate and leflunomide both are not contraindicated.
Yeah. Okay, 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 doctor. Thank you.
Thank you, Dr. Mahi. صراحة good case.
Yeah, very good case and nice performance and also nice presentation. Thank you, Dr. Mahi. Let's hear the comment from you. Then I will comment.
هو بس أنا بس عايز أقول بس إن examination of the hand.
Yeah, but try to make it in English because we have some of non-Arabic speaker. Okay.
Examination of the hand in this case, look, feel, and move. So by inspection, we should look for the joints, which joint, and I will enumerate the joints by name: metacarpophalangeal, proximal interphalangeal joint, which one in the which finger. By inspection, the swelling. Then I will see for the thenar and hypothenar muscles and the dorsum of the hand for the guttering wasting of the muscles. If there is less likely for first attack that the patient can deformity, but if there is any deformity, I will ask the patient to do fist to correct this deformity. Then this is by inspection. Then I will go for the feel on the pillow. I will see if there is any tenderness. I will check the temperature in the hand and the nearby tissue. in the forearm as example. And I will catch every joint by itself and by my right hand finger index and thumb, and put my finger of the left hand on this joint to see if there is any fusion or no, like this. This yes, look, feel, and movement. This movement, I will check the function of the joints by doing yes prayer sign and the reverse prayer sign, or putting and unputting, or coin, any one of them enough for that. And may I ask the patient also, what about your cope in their daily activity? How there is any shortage of the function of the hand? And I will ask about his job. What is your job? Um, and how much is this affect your daily activity and your job? And I will involve the occupational health worker. If the example is this patient is typist and she cannot do this in the job, secretary and writing many by use hand much per day, so we can allocate here for another job. This is also I wanted to say these crepitations in the lung, maybe this is not crepitations of fibrosis. I should ask the patient to cough while I'm fixing the stethoscope. Cough 2 times, then again, excuse me, deep breathe again to see if this is fixed crackles or no. If fixed crackles, so mostly crepitations. The the extra-articular manifestations of rheumatoid can start with or before or after the hand pain. And it is not a complication. It is part of the disease. So can start with the joint pain itself. Yani before we think that this is a complication of rheumatoid, and after patient develop deformity and the joint, then later on 1 year, 2 year, we will find the crepitations of lung fibrosis. This is not the right. The right is the extra-articular manifestation can start with rheumatoid from the start, or even before the start of the hand pain. This my comment on this case. Yeah.
Okay.
I wanted to add also,
Yes.
patients with rheumatoid arthritis is a risk factor for osteoarthritis.
For what, sorry?
Usually for osteoarthritis. Usually
okay.
we think that osteoarthritis is a disease of elderly patients. But we have one colleague, he went to the exam and he answered everything right, and he forgot to examine the knee joint. And this patient, about 55 like this, and he had status post knee joint replacement with a scar in the knee. And he forgot to examine the knee, and the examiner failed him in this station because he did not ask the patient about any previous surgery, any surgery in the joint before, and this patient was status post. So what is the cause of this knee replacement? It is premature osteoarthritis as a complication of rheumatoid arthritis. Okay.
Good case, Dr. Bahi. Thank you. Very valid, comments.
Yeah. Thank you, Dr. Mahmoud. Very nice case and presentation and performance as well for Dr. Ryan. I will start from the last advice as Dr. Mahi mentioned, and I always mention it. Please, please, it's a golden advice. You have a paper in the exam, so you are writing your scheme. Put a space for examination. Make space down, for example, half of quarter of the paper. Put it as X only for abbreviation. EX means examination, meaning that while you are taking history, you will find a lot of findings and you will catch a lot of things you have to examine. Believe me, if you miss any of them, you might fail the station. Okay, even tummy pain, if he mentioned to you, yes, I had before tummy pain, at least do superficial examination or palpation for the tummy. In this case, Why Dr. Ryan missed the knee examination? Although she catch it earlier, or she caught it earlier, that the patient is having knee pain, but because she didn't write it, I guess, Dr. Ryan, you didn't write in your paper if you are doing that. I believe everyone has to write before the exam. Any
I don't.
serious,
I
yeah,
don't have a paper today, Dr.
it's okay.
Basim.
Okay, but please train on that. Why? Because what you are doing in the practice, you will do in the exam. So whenever you are practicing, you have to pick up the findings, write it down in the paper. Ex means examination. So whenever you find positive thing in the history, you have to offer it or to do it as examination. At least offer it. For example, if you have eye problem in this patient, redness or whatsoever, even it was in the history before. He told you, yes, I had history of dry eye, which is keratoconjunctivitis sicca syndrome, okay? So at least while examining from the face, mention or at least do like you are checking for any dryness of the eye or redness in the eye, okay? You have to do it. Believe me, the examiner, they are judging in every simple thing in the examination. Okay, I will start from this point because it's very important. You have two skills in the exam related to the examination: physical finding and identifying the findings. What to do? Write in your paper what you have to examine from the hand till the toe, the little toe in the feet. Because you are starting from the head. For example, in this patient, you will start from the hand, as Dr. Mahi said. Hand, look, feel, move. Look, feel, move. Look for the deformity. Make the show or point to the ulnar deviation. Point to the swan neck deformity, for the Z-shaped thumb, for the other one, boutonniere. Any deformity in the hand, you have to point to it. Okay, because sometimes also while you are presenting, you forget. At least point to them. Olecra as the elbow for rheumatoid nodule, you have also to point to it. Skin tightness. I don't know why you missed the skin tightness here, Dr. Ryan, even at the history or at the examination. Yes, it's rheumatoid patient, clear, or isolated rheumatoid, but you have to roll out that patient doesn't have any tightness. Okay,
Yes,
this is
in the
the.
history, I think I asked, but in the
You
examination,
asked?
in the history, I asked, but in the
Okay,
examination, I
at
forgot.
least, no problem. At least you asked. But always remember this case or this type of cases coming like this, association or isolated. Even isolated, you have to rule out no association. Why? Because he will ask you during the Viva question, did you examine for skin tightness, for systemic sclerosis? If you said no, you'll be in trouble. But if you said yes and I roll it out, it's good and you'll be safe. Okay. If you forget, I think you'll be in trouble because it might be the case. It might be associated or not. But if you didn't, since you did not do it, it might be the case, and you will miss the diagnosis, and you will miss the differential. You will miss a lot of things. So please remember, in dermatology, check and examine for the association. Unless you ask in the history, do the examination, or the opposite. If you didn't ask in the history, do the examination. Okay, either to ask or to do both, but never ever leave both of them. Okay.
Okay, sure.
Yeah, this is related to the differential, and as Dr. Mohi said, this is rheumatoid arthritis case. I don't want to speak more about the rheumatoid, but it's a very common and high yield topic in the exam. You have to be prepared well with the investigation, the management, the admission or not, as Dr. Mohi asked in this question, in this scenario. It's not necessary to admit, but if there is any complication, pulmonary hypertension, or something hypoxia related to the acute presentation, you have to admit. Apart from this, refer the patient to multidisciplinary team or group of doctors. Okay, back to the joint. Uh, I think you cover all the investigation and the specific. Start to mention the specific. Some examiner, I think most of them, they are bothered why you are saying while you are mentioning general investigation, and you will mention a lot of investigation which is not related to the case. He has 5 minutes with you, right? And he doesn't want to hear a lot of investigation. He wants to be target. So what you have to mention, start like this: general investigation, specific investigation, bedside investigation. For the specific investigation, as you said, rheumatoid factor, anti-CCP, and other antibodies for overlap syndrome or for mixed connective tissue disease if you want to roll out. And when once you have a case of rheumatoid, you have to do the all autoimmune profile. You can say like this: autoimmune profile. Okay. Apart from this, bedside test. What you want to examine in the bedside test? If the patient suspect to have diabetes, so I will check blood sugar. I will do a carpal tunnel nerve conduction study. I will do ECG if you suspect pulmonary hypertension or any complication to the heart. And also you can say spirometer if you suspect any interstitial lung disease. This is the way how to mention the investigation. Always they like to present with the specific, or if you it's preferred to say bedside. Okay, it's a very nice way to mention to him bedside, and he'll ask you what you mean by bedside. And if you mention the bedside test, it will show him that you are very expert one. Okay, because bedside test means you selected some test related only to this case, and you can do it. It will help you to roll out or to roll in some complication like pulmonary hypertension. You have to mention echo here. I want to do echo to roll out pulmonary hypertension. Okay, the management, I think also you cover a lot of things, but you forget the steroid as bridging before starting the meds. It's at the beginning of any DMARS, you have to start with steroid as bridging for with overlap 2 weeks, and you didn't also mention the biological therapy in case of we have resistant or no response to the DMARS. For after 6 weeks, we have to think about monoclonal or biological therapy in the form of infliximab and adalimumab or etanercept. Always remember these things. It's very specific to the rheumatoid. Okay. Last advice, Dr. Ryan.
Thank
Last,
you so much.
yeah, last advice. The history. If you think the history is or the things you are asking in the history irrelevant or not related to the case, please ignore it. Ignore it totally. You spend the time. Yes, I know it's some lagging in the internet, but I guess also you ask a lot of question which is not related. Why sharing needles in this patient? What do you think is related? In the exam, by the way, you have to be very target. You have to finish really literally within 8 minutes. You have to finish. Why? Because you have a lot of examinations or a lot of findings you have to examine. Such patients, you have to examine the knee, the hand, the chest, the heart, the eyes. Imagine for how many minutes you can spend time to examine all these things. At least you can jump from 8, I mean from the minute number 8 going to 13. So it will be 5 minutes. You have to spend all this timing because the concern will be waiting for you. So
Yes.
yeah, I think for the internet also issue, I cannot judge on the other clinical communication, but the only advice here, try to minimize the unnecessary question like the HIV history. And also the important question here, not the pregnancy compared to the missed pregnancy. As you said, birth control pills, I don't know why is it relevant to ask about birth control pills? Unless the patient is having miscarriage, yes, I have to ask. But yeah, I agree to ask. But the pregnancy, you can skip. You can ask about the missed pregnancy rather than asking about any pregnancy. Okay. Okay, let's move. Can you write the case, please, scenario for Dr. Mahi? And anyone has comment or question, he can ask, please. Dr. Ibrahim, yes, he's always writing precious comments. Examiner will ask about poor prognostic factors and good prognostic factors in rheumatoid. Yes, I agree. If you can write all of them, it will be better. I think you mean for the follow-up, right? Anti-CCP and the rheumatoid factor, or you want something clinical? You can specify more the question, please. Steroid, yes, this is my comment. Para-articular, yeah, osteopenia, erosions. You have to measure all these things. Narrowing, the most important thing, narrowing of the joint space. Okay, your case, Dr. Mahi, Sarah, Madam Sarah, or Miss Sarah, 52 years old with tiredness. I will give you 2 minutes until finishing these comments. Yeah, did you examine for calcinosis, Dr. Ryan? I wrote it for you because you have to examine for it. Calcinosis and ulcers.
You are right. I missed it, Dr. Bassem.
Yeah,
Yes.
yeah, it's characteristic for Raynaud's. But you cover the Raynaud topic well by mittens and warming the hand. Smoking also here is very important if the patient is smoking. Yeah, I think we cover the other questions. Yes, the differential in any rheumatoid, you can safely say 3 cases, and they are related to each other. So rheumatoid itself, as isolated, you can say overlap syndrome if you have rheumatoid, of course, and mixed connective tissue disease if you have some of the other autoimmune like systemic lupus and dermatomyositis. They are differential to each other. But for the hand pain, yes, as Dr. Ryan said, it's carpal tunnel syndrome, rheumatoid, or any arthralgia like SLE, Charcot arthropathy, I mean.
Dr. Bassem,
Yes.
what's the difference between overlap and mixed connective tissue? Is there any
Yes,
specific difference?
yeah, mixed connective tissue is the component are systemic lupus, rheumatoid arthritis, and systemic sclerosis with dermatomyositis or polymyositis. Okay, with or without Raynaud's. Overlap, it will be, and of course, you will have an anti-ribonucleotide antibodies positive. Okay, you have to mention the name. I prefer to say the name, full name, I mean, not RNB. So ribonucleotide antibodies, okay? Anti-RNB and ribonucleotide. For the overlap, rheumatoid arthritis with any of these, but rheumatoid is necessary.
Okay.
Simply, okay, simply. So the difference between overlap and mixed connective tissue, that rheumatoid will be in both, but the mixed connective you have SLE, you have systemic sclerosis. But overlap you can have only rheumatoid with one other in autoimmune or connective tissue disease. Okay.
Okay.
Okay. Thank you, Dr. Ryan. Dr. Mahi, when you are ready, let me know. Anyone has comment or question? For the,
Calcinosis specific for Raynaud or for systemic sclerosis?
what is it?
Calcinosis.
It's for Raynaud.
لا calcinosis for crest syndrome صحيح؟
Yeah, Chris, yes. The ulcers for Raynaud, yes.
Yes, the
Calcium,
ulcers.
you're right, yes. Thank you, Dr. Aish.
Okay, thank you.
It's called sclerodactyly, right? This is for
Yes.
yes. And also the mouth opening, Dr. Ryan, you must open your mouth.
I think all this, Dr. Bassem, the case already has a lot of things to examine. I think they will, if no finding in history, we should also examine.
Not necessary, but
I
at
think
least
she should start with the finding already, the positive in
yes,
his
exactly.
history.
Yes,
Yeah.
exactly, yes.
Uh,
If she has time, and also if she didn't ask, she has to do. But if she asked, she
I
will
think
roll it out.
in every case we should examine the hand and the eye and the mouth. This is for all cases.
This
This
is
is like
this is
general
for
examination, and
Mhm.
they asking for
you,
that. And I think it is well included as you see a lot of things, like in the eye, because she has
Mhm.
before red eye. The mouse, maybe he will think that you check also for tight skin like that.
Exactly, yes. You know, Dr. Aisha, what I added also as a preferable way in the mouth,
Mhm.
in all my cases in the training, I was asking, show me your teeth. So I can see the dental hygiene. I can see also the
It's good. Yes.
gum hypertrophy. And already you are opening his mouth. So show me your teeth. it will show the examiner that you already screened. For example, in infective endocarditis, dental hygiene is important to screen for.
Important, yes, yes.
Yeah, so
Yeah.
it's easy to tell him,
This is
please.
good. Yes, good point.
Yeah.
Okay. Yeah.
Do it as an approach while opening the mouth. Show me your mouth, the tongue up. Show me your teeth like this. You will see at least the gum hypertrophy if the patient on immunosuppressant, for example, cyclosporin or whatever, or at least you will see some of the dental caries if he's
Oh,
infective
and the mouth
endocarditis.
opening also. Yes.
And of course, mouth opening. Yes, this is for
Yes.
systemic sclerosis. You're right. So make it as a habit. Add it to your approach. Please open your mouth widely and show me your teeth. It will be
Mhm.
included all these things. Okay.
Yes, this is good. Okay.
Yeah. Thank you, Dr. Aish.
Thank you, Dr.
Assalamu alaikum,
Uh,
Dr. Basu.
Alaikum salam, Dr. Azhar. Yes.
Today there was a net problem, so I could not join. I joined very late.
It's okay, Dr. Azhar. Anytime you are welcome.
Can you repeat what is the difference between mixed connective tissue and overlap? It's
Simply,
always confusing.
yeah, simply overlap includes rheumatoid with another disease. But connective tissue, mixed connective tissue, you have SLE with systemic sclerosis and rheumatoid arthritis.
We will a polymyositis dermatomyositis maybe.
Yes, of course, it could be also one of the component, but the necessary investigation for mixed connective tissue, anti-ribonucleotide, you have to mention it. But for the overlap, it's not necessary to be positive, or it will not be positive. Okay.
In overlap, you mean say rheumatoid arthritis or simply SLE or systemic sclerosis? You mean
This
to
is
say
mixed
like
connective tissue. No, rheumatoid arthritis should be in the overlap. I mean overlap with any of the autoimmune, but not or with overlap. That's why it's called overlap. So rheumatoid overlap with some single disease other than rheumatoid. But mixed connective, you will have a lot of findings like SLE, systemic sclerosis, and rheumatoid, and also
and
antiphospholipid.
and the antibody
Dermatomyositis.
anti-RNA, it will be positive in mixed connective tissue.
Yes, exactly.
And in the overlap, no anti-RNA will be positive.
Rheumatoid factor, no anti-RMB, you will have rheumatoid factor, and anti-nuclear antibody. Anna.
Oh,
Okay.
thank you.
Okay.
Thank you.
Thank you, Chris. Dr. Mohi, you ready?
Yes, yes, yes.
Yeah, here you go. You can start now.
Hello, I'm Dr. Ganab, Senior House Officer of the Medical Clinic today. Am I talking to Mrs. Luna and you are 52 years of age?
Yes, doctor.
Today we will discuss your health issue and examine you and address your concern. Is that okay with you?
Yes, doctor.
Initially, may I ask you which brought you to the hospital today?
Yes, doctor. Actually, I am having severe tiredness. I am tired all the day for the past maybe 9 months. I don't know what's wrong with me. I am getting tired day by day.
This is first time for you to feel this tiredness?
Yes, I was completely normal before that.
Do you think it is same or worsening or improving with time?
Worsening a lot.
Any any specific time of the day you feel tiredness? More in the morning or more in the evening?
No, all the day, all the time.
You are feeling tired during rest or when you are walking and the daily activity?
All the time, doctor. During rest, during
Even
daily
at rest?
activity. Yes, even at rest.
Yes, and also there is no specific time it increase in the morning or in the evening.
No.
Okay. Apart from this tiredness, what you feel else? Do you have any other problem
Like what, doctor?
like shortness of breathing?
No,
You don't have any shortness of breathing?
no,
Okay. Any change in your weight?
no, not really.
Any rise of your body temperature? Did you check it?
No.
Any sweating by night?
No.
Any lumps or bumps in your body?
No, I didn't notice.
Do you feel any weather preference?
No.
Any hard motion or change of your bowel habit?
No, doctor.
Do you feel any racing of your heartbeat?
No.
Okay. May I ask you, do you have any past medical history I should be aware of?
No.
Any surgical operation before?
No.
Any blood transfusion?
No.
Hello?
Hello? Yes, doctor.
I
Continue.
ask you, do you have any surgical operation, any hospital admission?
No.
What about your mood, Mrs. Luna?
It's good.
Do you feel any pain anywhere in your body?
No pain. No.
Only tiredness?
Yes.
Do you have any skin rash?
No skin rash, but I am itching a lot.
Itching?
Yes.
Which part of your body you feel itching in it?
All, doctor. All body.
All body? Do
Yes.
you feel any change in the color of your eyes?
No.
Any abnormal hair growth in the body?
No.
Okay. May I examine you while I'm taking a history from you?
Yes, doctor. Sure. Give me
I
a while.
wanted
I
to
will
start
send
from
the.
the head.
I will send the picture. Okay.
Okay, send it. Send it.
Yes. Continue.
I did not see the picture.
I will send in the group, Dr. Basim. Okay.
Yeah, sure.
Yeah, I sent in the group. Okay, you can continue, doctor.
Okay. I wanted to see the hand if there is any change in the any pulmonary edema, any between contracture and the
No.
palm. Is there any like this?
Nothing.
Any thinner or hypertrophy? Back of the hand, is there
In
any change
just
in the skin in the knees?
sorry.
I did not see the picture.
I think it's
What
loading a little of
about
connection issue. You can continue. I will tell you.
okay? What about pulse? Is there a rate or volume equal on both sides?
Dr. Mahir, pulmonary edema is positive. Okay, sorry.
There is pulmonary edema.
Yes.
Any between contracture?
No.
Any proximal myopathy in the arm?
No.
Any change in the face, eyes? There is pallor, there is jaundice.
No jaundice.
Any rash in the mouth, in the face? Butterfly rash?
No.
Any problem in the mouth, hygiene or ulcer? Do you have any sore in the mouth?
No, sir.
Okay.
I sent the picture in the group. Okay, in the chat box.
Sure.
If you are able to see. Okay.
Okay. Well, in the neck, there is any swelling in the front of the neck? Thyroid
Sorry.
lumps, lymph node, thyroid gland.
No, no swelling.
It is seen in the front of. ما
I
في؟
couldn't hear you honestly. Can you repeat? I did not hear you.
Okay. May I ask you, Mrs. Luna, there is any family history of note? Any family history of cancer?
No.
There is xanthelasma around the eyes. Did you check your lipid profile in the blood?
No, I did not check.
Do you have any claudication or limping while you are walking?
Limping? No.
Okay, I wanted to examine the abdomen. I wanted to feel the liver. Is it palpable liver or
Yes,
tenderness?
palpable hepatomegaly, 2 fingers below the costal margin.
Okay. Mrs. Luna, did you check your blood sugar before and blood pressure?
No, doctor, I did not check.
Uh, I wanted to offer to check the diameter of the waist of the patient, or diameter of the.
Normal
Okay,
waist, nothing specific.
there is no يعني there is no obesity or overweight mainly in the trunk.
No obesity, no overweight, no.
Okay, joint the dorsum of the elbow and the tendon of the heel to see if there is any lipid deposition in these areas.
No.
Okay, okay, okay. May I ask you, do you have any history of travel?
No.
Sorry to ask you this. Do you drink alcohol?
No, doctor.
Do you smoke?
No.
What is your job, Mrs. Luna?
I am housewife. I don't work right now.
How much this tiredness affect your daily activity?
It's affecting me a lot. I cannot do my daily chores.
Sorry for that, Mrs. Luna. We hope we fix this problem for you. May I ask you about your diet? It is balanced diet.
Yes, balanced, I think.
Do you have any fast food?
No.
What about your exercise? Do you exercise properly or you don't?
Yeah,
exercise?
I do mild exercise, like regular, not very heavy, not sedentary life.
Okay, Mrs. Luna. May I ask you what is your concern, Mrs. Luna?
Yes, doctor, what's wrong with me? Why I feel tired all the time?
I'm sorry for what you are feeling, and I appreciate your concern. My mind now is going with a medical term name as NASH, in which there is problem in your liver. There is deposition of the fat in your deposition of fat in your liver. So it affects your daily activity like this, and the liver is not in good situation. I will run for you some investigation and imaging for the liver, and I will also do some blood tests in the form of checking your blood sugar and lipid profile for this. Then after release of these investigations, I will sit with you and will put a plan of management for you. Okay, Mrs. Luna?
Okay, doctor.
Do you have any other concern?
No, doctor.
Sorry to ask you, do you have any heart attack before?
No.
Any stroke or mini stroke?
No.
Okay, Mrs. Luna. Do you have any joint pain?
No.
Okay, Mrs. Luna. Okay, Mrs. Luna. Thank you.
Thank you. Anything else you want to say?
No, I don't want to talk.
Okay. Okay. Can you present
Ask
your
me.
case?
This is 52 years old female patient. She suffered from fatigue for 9 months. It is worsening with the time. Um, associations. When I examine here, she has xanthelasma and palpable liver, enlarged liver. So possibly this patient has NASH or non-alcoholic steatohepatitis.
Okay. What are your differentials?
Differential other liver diseases in the form of viral hepatitis, but against this, there is no attack of fever or blood transfusion or any. I forget to ask here about any casual relationship or like this as a source of viral infection. But also hemochromatosis is one of the differential diagnoses. But against this is not in the same age, and there is no any associations of heart failure or joint pain like this. So it's all the diagnosis is going with NASH mostly.
Any other differentials? Or
I asked here about possibly this is chronic fatigue syndrome, but against this, there is positive signs of this patient, and here mood is okay, so not it is not going with psychic troubles or like this.
okay.
Maybe also cancer, but against this there is no any constitutional symptoms like weight loss or fever or night sweating like that. So, and long history also 9 months, so less likely to be cancer liver or any cancer anywhere.
Okay. What are your investigations?
Usually also from differential diagnosis, chronic infection like infective endocarditis or low grade such as TB, this can cause this tiredness with, but not matching also away. Investigations I will do for here lipid profile, hemoglobin A1C, and you will check here blood pressure also. And I will do ultrasound for the liver. This is specific for the diagnosis of NASH. Also, I will do liver function test, ACT, ALT, gamma glutamate transferase, serum bilirubin, serum albumin, prothrombin, and INR. That's it. Yeah.
Okay. What is your management plan?
Management plan, it will include control of these associations of the non-alcoholic steatohepatitis. I will advise for control of the diabetes and exercise, pharmacological and non-pharmacological.
But she doesn't have diabetes.
Possibly it will be either diabetic or pre-diabetic. So exercise and it will improve this insulin resistance. Also, if she has blood pressure rising or about to rise, so exercise will improve this. This fat in the liver, it will be corrected by change lifestyle. She deny any fast food, but mostly balanced diet and healthy food can improve this with exercise also. There is one medication, usually we write this medication, prescribe this medication for fatty liver, but I cannot, also Falc, or I cannot remember it now.
Okay. How can you explain the itchiness in this patient?
Usually, I don't know why she has itching, because bilirubin, there is no jaundice. Maybe subclinical jaundice, I don't know really.
Okay. Let's say if this patient has subclinical jaundice and itching, any other differential that comes to your mind?
Yes, primary biliary cirrhosis, it is one of the differential diagnoses in such a case. There is lipid profile is high and itching, but it is one of the strong differential diagnosis really, primary biliary cirrhosis.
This is actually the diagnosis here. It's primary biliary cirrhosis. I don't know, but what I know, I mean, your differential of NASH is valid, but what I know, usually they have risk factors of diabetes, hypertension. She told you that I eat balanced diet, I do some exercise, I don't have these conditions. Yeah, she told you that I did not check, but there is no past history of note. So I think with the history of the pleuritis and the hepatomegaly, middle-aged female, you can put primary biliary cirrhosis top, and then maybe you put the NASH. The xanthelasma is also a strong association with the primary
Yes.
biliary cirrhosis,
It
isn't
is
it?
Yes, you are right.
Yes. Okay, well done, Dr. Muhyiddin.
You.
Yeah, thank you, Dr. Ryan. Very nice case, and well done, Dr. Mahi. Let's hear the comment, then I will comment.
Okay, I think in the history you missed a lot of stuff because maybe you moved from the history to the examination. I don't know. So you did not ask about any abdominal bloating, any feeling sick, any all this you missed, and the history for the hepatitis, as you said, you missed, which is very important in this case because, as you said, any viral hepatitis could be a risk factor. So tattooing, piercing, sharing needles, all of these, and the sexual history and the blood transfusion. I think otherwise your history was good. In the examination, I don't know if you scanned for the scratch marks, any injuries like in the scratch marks. Check the jaundice and nothing else. You did the examination. The rest of the examination was well, and you checked the xanthoma as well, which was good. In this case. In the investigations, you missed, because you missed the case, you missed the special investigations, which are the anti-mitochondrial antibodies, the serum IgM levels, smooth muscle antibodies, special imaging like MRCP can be considered in this case. Regarding the management plan, the first line is also deoxycholic acid, like apart from the non-pharmacological management. And for the pleuritis, cholestyramine, and you can consider later on liver transplantation with certain indications. I think these are my comments.
I take about 4 minutes taking history from you, and you did not give me any clue for the case. Everything, no, no, no.
I gave
have
you the
to- you
case
have-
exactly as it
Yeah.
is.
Yeah, Dr.
So
Mahi,
I
excuse me.
jump
You
into
have
the
to.
examination.
You have to. Not she is the one.
Even Dr.
Yeah.
Dr. Mahi, even when you asked me about any skin rash, I told you I don't have
She told
rash,
you,
but
yes.
I have
Itchiness.
itching. Yes.
Yes. She
It
she
was a
was
clue.
volunteered to tell you about the itchiness, and which is the clue of the case. I agree with Dr. Ryan. She gave you the case, but you skip the itching. I don't know why you skip the itching. It's
Yeah.
very important complaint. You have to analyze it. You have also to examine it. You have to think about what's related. Why this itching coming? Is it polycythemia? Is it related to hot weather? Is it related to shower? Is it related to jaundice?
Scabies, anything. Yeah. Could be scabies as well.
Yes, a fungal infection. Exactly. You skip it totally, like she didn't mention.
Quickly, really, I don't know how to analyze this itching. What I will ask about it.
When it started, is it
Uh,
related to something? Is it related to food?
Is it at night? At night scabies, for example. Like this few
mm,
questions to see, like to show the examiner that you did not
Yeah, exactly. Where
get it.
exactly is itching? Is it in the hand? Is this in the extremities, in the extensor areas, in the knuckles, like scabies, as Dr. Ryan said, or all over your body? No, a lot of questions. Always remember onset, course, duration. At least ask these three questions for any complaint. Onset, course, duration. If you don't know how to ask these three questions. Onset, course, duration. What increase, what decrease? What improve, what worse? That's fair enough and more than enough if you didn't have a lot of questions to ask. But of course, you can ask where exactly, Is it related to timing? Is it related to weather? Is it related to food? You can create some of the triggers to be related to the complaint. Anyway, there is something missing. Yeah,
When she said
the
itching,
history.
my mind jumped to the porphyria cutanea tarda. So I asked abnormal hair growth, abnormal like this.
This is the
I
problem
thought
when
this.
when you are thinking or occupied by some conditions, you will never catch the diagnosis. Always
Yes.
screen. Why the itching in this case? And take breath. Okay, hold your breath and think. Even you can be quiet for a while to think more, but don't skip something might give you the clue for the case. Always, whenever the patient or the surrogate give you thing, believe me, it will be the clue for the case. Okay, they are trying to give you a clue. If you try to approach this clue, they will give you a lot of details. But if you skip it, they will skip it. Okay, really, this is the surrogate action. They should do that. They are distracted by this. Please, if he touch this point, as Dr. Ryan did, actually, she was very good surrogate. You ask her about any skin, and she give you the itching or the itchiness. This is the clue. You have to stick to this and ask a lot of questions for the itchiness. Why this patient is having itching with, because you ask a lot of things. She said no. Once you have something positive, you will skip it. Which yes, she said yes. She said no for no for everything. You have loss of weight, no. You have loss of appetite, no. Any high body temperature, no. And she said something very important. And for me, I can say this is one of the alarming sign and symptoms in the body. Itchiness is not something usual. Anyone will have it. It's something serious, either bilirubin or polycythemia related to allergy. Something it's not simple to skip it. Okay. Anyway, Dr. Mahi, you did great. And always the case you are missing, you will remember it forever. If this case came to you in the come to you to the in the exam, you will know it definitely. I'm 100% sure you will do it in a much better and professional way. Okay.
Usually about very big percentage of this primary biliary cirrhosis, it is associated with celiac disease.
No,
And I asked
لا
about any change in the bowel habit, and it was
no, you
no
did
no.
not. But you did not ask me any bloating. If you asked any bloating, I will give you bloating.
no
But
the
but you
GI
skipped.
he skipped all the GI. You didn't
Yes,
ask about
exactly.
tummy discomfort. Tummy discomfort will
Yes,
be positive here, right?
will
Any
be
tummy
positive.
discomfort or
Yes,
distension,
yes,
any
yes,
feeling,
exactly.
any feeling. I
This
think you have a lot of time. There is something missing in your approach and the system review. After 5 minutes you move to the examination, which is very weird. I remind you in the chat box, where is the occupational? Where is the social? You have to ask alcohol here, totally prohibited.
Mhm. I asked
uh,
about alcohol, but
yeah,
You
you
ask
asked
about
late.
alcohol?
Yeah, he
Ah,
asked
late,
but
yeah,
late,
yeah.
but he asked, yes.
Yeah, and one thing more. In the previous scenario, I said to Dr. Ryan, never ever or try to minimize the unnecessary question. In this scenario, the unnecessary question for her scenario now is very necessary. I mean, HIV and hepatitis as association or as a trigger or as a cause of the disease, it might be one of the differential even. You have to rule it out. This patient might have a stick needle or sexual contacts previously, and it might be hepatitis B positive, right? Patient comes with discomfort, liver or hepatomegaly, so it might be. And he might ask you, as Dr. Ryan asked you, Doctor, did you ask about hepatitis? But good thing you ask about the food intake. This is to rule out hepatitis. Any travel, which is very good also to rule out hepatitis A. I think you rolled some occupational disease by this question, which is good in this case. But the GI totally you missed. For me, as advice, in the system review, if you want to start from head to toe, CNS headache, blurring of vision, and weakness, needles, pins and needles, If you have complaint related to the CNS, add to them speech, any disbalance or imbalance, unsteadiness, hearing problem. This is in details about the CNS, but at least headache and blurring of vision is very important as one or two question in the CNS. Let's go to the next system, endocrine. Any weather intolerance? At least this question you will know if this patient having thyroid or no. Apart from this, I think it will not be related because unless you have complaint related to the endocrine, for example, acromegaly. So you have to ask about the size of the ring, the size of the shoes, and the other question for acromegaly. Pumping into the object. This is for the endocrine as quick screening. Next, the system is chest cardiovascular. Any chest pain, awareness of heartbeats. Fair enough. Of course, if you don't have complain with chest pain or cardiovascular system complaint, like chest pain, you have to ask all questions related to the heart. Awareness of your heartbeat, the how many pillows, exertion, leg swelling, all these questions will be related to this system. The next system, the chest, you can ask only two questions: short of breath or cough. And in certain scenarios, if you have serious disease like TB, you have to ask coughing up of blood. Fair enough for the chest. The GI, two question also. Any tummy pain or discomfort and bowel change. Any bowel habit change. Unless you have complaint related to the GI. So you have to ask about all question related. Any feeling sick, any throwing up, difficult swallowing, mouth sores, and also the eye. Anyone told you I become red or sorry yellow or jaundice or itchiness. Then the genitourinary, any change of your water work, if related complaint like dysuria, you can ask about change of the amount, the color, frequency, stones, blood, but at least ask any change of your water work. This is when you go through the system review quickly. The last system, two system, musculoskeletal. So any skin rash or joint pain. Unless you have also related question to the musculoskeletal. If you have joint pain, you have to analyze any other joint pain, any pain, what the nature of the pain, any back pain, any stiffness, morning stiffness. This is the way how to ask a system review if you don't reach the diagnosis. But if you reach the diagnosis, use one or two question only for each system. In this case, if you ask at least tummy pain or discomfort or change of bowel habit, I think she will give you a lot of finding, and you can analyze more after that because you have positive finding in this system, the GI. So you will ask about feeling sick, throwing up, change of the bowel habit, the related to the meal or related to anything else. This is the way how to screen and be smart while asking the question. Don't waste time and try to minimize if you don't have positive finding. Okay. Shortly, I try to make it a quick. Why I repeat? Because you miss the system review. You didn't do it in the proper way. When you finish or once you finish at minute 5, there is something wrong. Revise your approach and try to make it not details in too much details and also not very few or short like what you did in this scenario. Okay, try to be uh, like in between. Of course, don't forget the constitutional before anything. It will give you a clue for the serious disease or cancer. So the constitutional, loss of weight, loss of appetite, night sweat, night body temperature, and lumps or bumps. I think the case was clear. Also, Dr. Azhar and Dr. Ibrahim got the case from the question of itchiness or the complaint of itchiness. They wrote the diagnosis, primary biliary cirrhosis. The role of M in this scenario, IgM, anti-mitochondrial, and I think middle-aged female. Yes, this is one of the presentation. The jaundice and the itchiness. The treatment, of course, as Dr. Ryan said, cholestyramine and orthodeoxycholic acid. Uh, any question else or any comment about this scenario, Dr. Mahi?
ابدا والله، بس انا يعني اعتقد المفروض الواحد يتعلم، يعني ما يتوترش لما يقعد يسأل كده في الاول، يعني ان هو يكاتش ذا ديزيز ليت يعني.
No, no, no,
ممكن
no.
واحد
دكتور
يسأل
محي.
يسأل وبعدين اللي حصل معايا ان انا اتوترت اصلا.
Exactly. So what I will tell
الحالة
you
هتروح
as
مني.
advice, this is your first practice with me. Always these things will be fixed with frequent practice. It's not from the first. You will, of course, you will. Today you are excused because this is. I don't know if you practice with any other mentor or.
ابدا.
Yeah. So that's why you will be like stuck, and you will have mental block. What I do, what I. But with the listening and the practicing, everything will be fixed. No worries. Even at the minute number 12, if you don't have the diagnosis, you will be very confident to say three differential, and your case will be the second or the first differential. Okay, so no worries at all. It's a usual habit and it's a usual feeling, and all of us pass through these things. So no worries, don't worry at all. Try to practice more, and you will gain more experience in the paces and in the practice. I mean, okay.
Excuse me, I want
Yeah,
to
Dr.
ask
Azhar. Sure, sure.
from Dr. Muhyiddin. You did very well. I think you did first time. Inshallah, you will be better in future. Why you were thinking about PCT? Did you find any triggers regarding the PCT?
Dr. Mahi.
What is BCT?
Porphyria.
Porphyria tarda, yes.
Because it has itching, yes, because it is associated
No,
with
no.
itching.
The
Is
triggers
there?
for the PCT are if the patient is taking any pills, iron overload, alcohol, past
Hepatitis
history of
C.
hepatitis C, or
Yes.
hemochromatosis due to the
Yes, yes,
excessive
yes.
iron load. I have made
Yes.
this mnemonic PIA. PIA, yani Pakistan International Airline, PIA pills, iron overload, A alcohol, then two hepatic conditions, hepatitis C virus, or hemochromatosis. These are the 5 triggers. If you found, then you can ask if you have more growth on your face, like hypertrichosis. So there was no such clue. So
And
inshallah,
also, I want to add, sorry for interruption, Dr. Azhar. I want to add that the skin condition in porphyria is usually blistering. It's not only
ballistic.
mild itching. Yes,
Yeah,
it's a
blister.
very like bad shape rash. Yes.
And there may be also intermittent abdominal pain also maybe, and the patient may have constipation overlapping with intermittent porphyria, acute intermittent porphyria. But the differentiating point will be blisters and triggers.
Yes.
Can you repeat again the triggers? Iron overload, hepatitis C, what else?
There will pills
Alcohol.
produce
OCB, what else?
OCP, iron
Alcohol.
overload, alcohol,
Alcohol.
then
Alcohol.
Anesthesia also.
alcohol, and then 2 hepatic conditions, hepatitis C virus and hemochromatosis. 5, these
Alcohol.
are the triggers. These
Anesthesia,
are
I
the
think
5.
also, right, Dr. Azhar? Anesthesia.
But
Halothane, I remember.
I remember only 5. I didn't,
It's okay.
maybe
It's
it
okay.
is there. Maybe,
Yeah,
maybe.
yeah. At
But
least you know that there is trigger for it. Yes, and
yes,
the
yes,
sun exposure as well.
Sun
yes, yes, yes.
exposure, yes. Sun exposure,
Yes,
Sun
yes.
exposure also,
yeah,
blistering rash.
yes, exactly. So thank you, Dr. Azhar. Very precious comments as usual. As again, Dr. Muhi, it's a matter of practice and training because you didn't face this scenario before, so you didn't know it. But once you practice and you catch it once, or you know about it once, I think you'll never forget it again. Okay.
Yes, yes.
So
Okay.
it's okay. You are welcome, and anyone is welcome to practice in the sessions anytime. Just message me, and you will be the candidate easily. Okay. And thank you also for being volunteer to practice today. It's not easy thing to practice in front of others, and this is what give you the confidence in the exam. Believe me, whenever you are confident here, still the exam has different stress which make you forget everything. So please be ready with a lot of practices and participations. It's not easy to be confident here, and also it much be difficult in the exam to be more confident during the exam because of a lot of stress. The examiner looking at you, the surrogate talking to you, the patient sitting there. It's different, really. Believe me, it's a very different feeling. But with the practice, you will overcome all these things. Okay, anyone has other comments? Dr. Ibrahim, I think he wrote good thing when it started the complaint about fatigue. Think about something serious, either cancer or infection, serious, of course, serious infection, serious cancer. Anemia can give you the fatigue. Connective tissue disease can give you the fatigue, and any hepatic complication or hepatic condition can give you the fatigue. And the last thing, multiple sclerosis, it might be as a presentation of fatigue. Okay, of course, away from the chronic fatigue syndrome, which is the main name of the disease, you have to remember chronic fatigue syndrome along with fibromyalgia. This is how easily you can get the fatigue approach. Some some of doctors making it as related to the weight, either in gain weight or loss of weight. With loss of weight, cancer and infection, serious infection, and connective tissue disease, autoimmune. And with the gain or weight gain, you can think about endocrinology like Cushing, like hypopituitarism, hypothyroidism,
Hypothyroidism.
acromegaly.
Hyperpituitarism also,
Yeah,
obstructive sleep apnea also. So
yeah,
weight
obstruction.
is the most important question. In the
Exactly.
case of weight,
Yes.
I think our second question should be about weight. If weight is
Mhm.
more, then we will go hypothyroidism, obstructive sleep apnea, hypopituitarism, obstructive sleep apnea. If weight is normal, then fatigue. Then you will second question you can ask about appetite. If weight is normal and appetite is normal, then you can go for the diabetes, hyperthyroidism, and then few
Mm.
chromocytoma. Uh,
Exactly.
and then the weight is decreasing and appetite is decreasing. Both are decreasing. When then we can go to the chronic condition like chronic infections, TB, HIV, then cancers, the chronic vasculitis, like this is the uh, Wagner, or this is
Any
eosinophil,
vasculitis. Yeah, any
vasculitis,
vasculitis.
any vasculitis, any connective tissue, chronic diseases. So I think
Yes.
weight is the most important question. It should be after fatigue. When you, if there's a question of fatigue, then the next question should be weight. Then next
Yes.
it should be appetite. In this way, if we will organize, then it will be easy for us to approach the case.
Exactly. Yes. And add the itchiness always to the fatigue to catch the liver conditions
Yes.
or
The
jaundice and biliaritis. Yes.
the differential of the eating, you can remember this in your below your tummy. You can remember. You see easily HIV and chronic renal failure. Then you will come up that it will be chronic hepatic failure. Then you will move up towards the face. It will be polycythemia. And then in the you can also make uh, this diabetes and scabies we can also keep in mind. In this way we can at least memorize these things. We can answer questions like this if only there's a patient is presenting with itching.
Exactly, Dr. Azar. Thank you so much for refreshing the informations. Anyone has comment or want to refresh again, like Dr. Azhar? It's okay. By the way, this is the way how to repeat and how to memorize the thing. It's a matter of repetition and mentioning it in certain group, either by typing or verbally. It will make you more confident while talking. by the way, the stress facing the examiner is not easy. Okay, thanks everyone. Yes, Dr. Mahmoud Sardar. Yes, thanks everyone. You all did great. Yeah, I believe Dr. Mahi did great, and Dr. Ryan as well. A very nice session. Two very nice two cases and high yield topic. BBC or on any autoimmune condition. It's very common, and the rheumatoid as well. It's related topics. And by the way, both of them are female, so it's common in females. Examiner will ask about treatment prognosis, ultimate management, transplant indication. Yes, the definite treatment for any liver disease is liver transplant. And please don't forget to stop alcohol totally in such patient. Even minimal amount, it's not accepted. His liver already or her liver already is damaged, and the alcohol will make it more damage. And by the way, one of the contraindication of transplants in such patient is the alcohol intake. The patient, if the patient still insisting to get alcohol, she will not be candidate for transplant. Okay, hypothyroidism also causes the telasma as part of its lipid abnormalities, the plus fatigue. Yes, I like also the question by Dr. Mahi when he asked about any heart attack, any stroke or mini stroke. Yeah, just roll out any lipid abnormality, and you can ask any cholesterol. Okay, because cholesterol is known as non-jargon.
Also, I think we need to rule out bleeding here, Dr. Muhi, as a cause of fatigue. So, any loss of blood, any vomiting, like throwing up blood.
Yes, as well as the pallor, Dr. Ryan. Pallor, anyone told you you are paler than before? It's very important topic in patient the anemia, and it's very wide differential. Anemia, you have a lot of causes, a lot of presentation of anemia. It's not easy to get it and to pick up any of these causes, either pernicious anemia, iron deficiency anemia, hemolytic anemia, chronic blood disease, multiple myeloma. All this topic or all these titles under the term of anemia, and all of them comes in the exam, by the way. Okay.
I think if I wanted to say something.
Sure. Yes.
Yes, are you hearing me?
Yeah. Yes.
Yes, okay. I think for first contact, we should analyze what is the patient means by fatigue. Maybe
Yes.
he's complaining of muscle pain or dizziness and expresses as fatigue. We should know first what is fatigue, is what's meant by fatigue. And if there is fatigue and itching, we have liver disease, we have kidney failure, we have polycythemia rubra vera, and we'll analyze this. But he's good, but he didn't ask about urine output, how much. He didn't ask about if there is skin changes for chronic renal disease or something like this. But it's good. I didn't يعني did any interference before, but he's good for the first time. I think if I was يعني if I were him, I will do worse than him too
No,
much.
all of you are good, but it is a matter of practice. Really, if you practice once, you overcome this problem from the first time. It's a matter of first time practice. So don't worry. Anyone is welcome to do it, the practice, I mean, and the first time, the much difficult one, but after that, he will be perfect. And also you, doctor. Can I know your name, please?
My name Mazen Makram.
Okay. Thank you, Dr. Mazen, for your comment. And
Thank you.
it's again open for anyone who want to practice. He's welcome. Just chat me or message me privately, or at least you can write your name whenever I announce for the session. Okay.
Okay.
Thank you,
Thank you.
Dr. Mazen, for your comment again. Thank you, Dr. Mahi and Dr. Ryan. Anyone has comment or question? Dr. Ibrahim, I appreciate your all comments. Really, all your comments are nice and amazing. Dr. Mahmoud also, Sardar. Hypothyroidism. Yes, I read all the comment, right? Okay. Anyone has comment or question before ending the scenario? Sorry, ending the session. Any comment?
I think Dr. Ibrahim, he's always hiding himself back and he's not talking in front of us.
Yeah, you are triggering him. Okay.
He should also actively participate.
Yeah,
We are
please.
learning. We all are learning.
It's really, it's the first time only, the issue of first time. Whenever you did do it once, everything will
yes,
be
yes,
simple and easy.
yes,
So overcome this. Don't be afraid, and the exam will be much difficult than this.
yes. If we will hesitate in this condition, then it will be difficult
Yeah,
for us during the exam. We should
exactly.
try to open ourselves here.
Exactly. Yes. I prefer all of you to send me, and it's okay. If you don't do today, you can do tomorrow. We are doing daily practice, so you have a lot of opportunity. Just do it. Message me, and you can do it. It's so easy. I'm not also hard or tough in the comment. I think I'm trying to be more gentle,
Gentle.
because because it's a matter how to learn, and by both way they will learn. But I prefer to learn by gentle way, not by being tough, because the tough also behavior make the people. I think this is my opinion. The people will rush away from this meeting, but be gentle. The information will be easily approached, and hopefully all of us, inshallah, will pass this exam.
Inshallah.
Inshallah. Thank you again, Dr. Mahi and Dr. Ayan and Dr. Azhar, for your nice comments, and always being with us, Dr. Azhar. Thank you so much. Although it's very late for all of you, but Dr. Azhar, I think nowadays he's busy in his job.
Mm.
That's why I'm mentioning him by name. But all of you, really, I appreciate your presence. And Dr. Aisha, I will not forget you.
Yes,
Thank
she
you.
is also our active
Yeah,
participant.
yes. Yeah,
Thank you, Dr. Bas. I'll take the encourage in the
no problem.
next month, maybe.
Take your time, Dr. Aisha. At least be in the field during this time, because you will need to be more confident while you are practicing. But before the
Yes,
practice,
I'm
yes.
still hesitant on practice on private session, so
No,
still
no.
I
It's
regain
okay.
my confidence again.
No. Take your time. I mean, at least you are listening. At least you are
Yes,
attending on us.
yes,
Yeah. It's 1
yes.
hour. I'm trying to make it very short, or it's not long. 1 hour, 30 minute maximum. So it's just 1 hour, 30 minutes in a day for daily practice. For me, it's fair enough for basis practice. Unless you have a near exam, you have to do more time practicing and studying. But it's fair enough if you don't have a seat and you are preparing for basis, I mean, okay? Again, thank you, Dr. Ryan and Dr. Azhar and Dr. Aisha, Dr. Mahi, Dr. Mazen, all of you. Really, it's amazing session as usual. See you
Don't
tomorrow.
forget Dr. Ibrahim.
Yeah. Okay. Again, you are trigger. Okay, Dr. Ibrahim, you will practice soon. Inshallah, we'll hear you soon.
Inshallah.
He's insisting on you. Okay. Inshallah, yes. He promised us, inshallah. Okay. See you tomorrow, inshallah, with Communication Day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
عليكم السلام.